boardroom to the Senate floor, from first responders to technology innovators. Different roles, different stories, but one goal: to meet the need for crisis care and overcome the obstacles together. So join in. The Crisis Jam is starting now.
Well, I am really excited. We're at season 6, episode 235 of the Crisis Jam. Today we're going to be doing Battle of the Bills with Senator Tina Orwall from Washington and Representative Steve Eliason from Utah. They're both battling for better mental health. So very excited about that. I'm Megan Haupt. I'm Chief of Staff with the National Association of State Mental Health Program Directors, and I am really excited to be here today and so glad you are. So let's go to the next slide. Wonderful. So we did this in the Backstage Pass. If you join early, you will be able to hear sort of some tidbits behind the scenes. And our sound check for this week is, what's a recent win you'd like to celebrate? This whole episode is about successes, legislative successes, policy successes, initiative successes. Tell us in the chat what you would like to celebrate. One of the successes I love that NASHBIT has done is really supported, and this Crisis Jam has supported the video phone services for 988, which is huge for the deaf community. So excited about that. And I'm seeing it, and all these things going into the chat box of successes. Fantastic. And just going into some of the recent Crisis Jam highlights, what you saw there was the website. And so you can get previous episodes. This shows Ted Lutterman's feature presentation, but you can get all those past materials at that website as well. Great. And we show this live stream on YouTube, and you can go back and watch past episodes as well. We encourage you to like and subscribe. There are different types of episodes, which we love. We have debates, we have fireside chats, we have day in the life where we find out what it's like to be in the role that somebody who is responding. We have live and on locations, just great pieces and variety. So we encourage you to join by Zoom, but if you can't, do it by YouTube. Great. What's so neat? I told you we're starting season 6. And so we've had 6 years going into 2026. It'll be season 6. So excited about this. And the first episode of season 6 is Battle of the Bills. What's so cool, looking back, what have we really done? We've done so much. The outcomes, we disseminating crisis now. We've shared lived experience and had frontline experiences highlighted. We bridged silos. We've accelerated the implementation of 988, as well as building out the crisis services. So this has been the go-to. And we've had so many experts. Our community is so large. And so we just encourage to get that word out, but look at all those successes. I won't go into everything there, but it's enormous. So thanks for all the great work. Wonderful. We're going to move to our crisis news. These are just examples of some of the things we've reported on. Today we have a theme. It really has to do with AI. We highlighted this last week as well, but if you use AI for therapy, here are 5 things that experts recommend. This was in the Washington Post. So generative AI chatbots are available and accessible, and people are using them. And here are some best practices as recommended by mental health experts. That was September 6th. Great. And here's another one. Regulators are digging into AI chatbots and child safety. That's out of the New York Times. Great. And this is The Guardian. ChatGPT may start alerting authorities about youngsters considering suicide, says CEO. So that's important in the sense that they're thinking about policies for this. I am now also going to move it to Ursula Whiteside to talk about the role of AI. And Ursula is the CEO of nowmattersnow.org. She is also a clinical faculty at the University of Washington and national faculty for Zero Suicide Initiative. So she's very passionate about improving AI for users who are having suicidal thoughts. Ursula, please go ahead. Thank you so much for being on.
Absolutely. Can you hear me okay?
Yes.
Okay, great. So again, I'm Ursula Whiteside. I'm from nowmattersnow.org. Over the last 3 weeks, our coalition of clinicians and researchers, 988 leaders, and lived experience advocates have been building a rapid response to AI chatbots and what's happening in that area with suicide, especially with youth. So I'll give you a 3-part snapshot, which is that what we've learned from expert email roundtable, our joint letter and recommendations to OpenAI and other large language model developers, and the public conversation that's what's going on in the media. So where the experts in our where the experts have converged in our email correspondence is that we know that these models are already acting like therapists, these chatbots. They're designed to maximize that engagement, which can conflict with safety in the case of suicide risk. For us, there's 2 non-negotiables that have resurfaced repeatedly that we want these organizations to prepare their models so that they never provide lethal means guidance, especially for those saying, I'm just researching. We want those to run into to stop there. We also want to have relentless disclosure around the fact that the chatbot is a machine. So messaging that says, I'm a machine. Who can you talk to right now? Repeated, not just once. We also want the youth to be the focus first. So our strongest consensus is around teen safeguards, real parental controls, and transparency about how these models degrade over time. And we also want to avoid police and hospitalization, involuntary things, because we know that from the lived experience community that these can be challenging. So we love for them to explore direct handoffs to 988, which is what was done in social media beginning many years ago. So to do this, we began by sharing our letter, which is an open acknowledgement of the progress that, in this case, OpenAI has made, where there are improvements around safe completions, parental controls that are underway, and teen-specific guardrails. So our directives are, again, to explicitly connect people to humans and provide improvements for especially youth over time, so that as the user interacts with the interface, that it doesn't degrade. That seems to be where we see these really unusual response patterns with OpenAI and other chatbots. So we'd love for them to implement proven models in humans that are safe, 988 integration, carrying contacts, safety planning, DBT skills, CAMs, to alert people to these things that are helpful and that exist, lived experience, leadership alternatives to involuntary hospitalization. And we want to help people and them to frame this, that most life-threatening crises are about 24 to 48 hours. And that during that window, we can potentially partner and prevent suicide deaths. So, so I will close with that. I think this isn't about perfect chatbots. It's about having frictionless human connection while people are in the high emotional, intense red zone, where they may not be thinking as clearly than they otherwise have. So I'll pause there and I'll share our letter and a couple of resources in the chat.
Ursula, thank you so much. That's so important, that human connection, and that it would help bridge that. So thank you so much for your work on that.
Absolutely.
And now we are going to go, let's go to that next slide. The Crisis Jam swag. Who wants to win some Crisis Jam swag? This is our trivia hot seat, and we have Dr. McKeon, who's a senior advisor for SAMHSA, as well as Sarah Blanca, right, who is the Crisis Associate Director for Optum Health. So we wanted to ask a question, and notice we're doing kind of a team today, right? So we invite all of you to create a team of maybe 2 to 3 people, max 5 people, to do kind of a hot seat over under type of thing. All right, let's go to that question. Oh, let's not forget about the swag, of course, and the store. Okay, so this is the question, and we want the audience to answer as well. So answer in the little prompt box there. The Community Mental Health Act of 1963 envisioned a meaningful life in, quote, the warmth of community, unquote, for those with SMI and or IDD. Which of the following was not one of the 5 key pillars of this landmark legislation? All right, I'm putting in my answer, but Richard and Sarah, could you talk through some of this? What are your thoughts?
Well, I'm glad to be here with you, Richard. Hoping that you have some thoughts. I think the ones that are jumping out to me that I wonder about is inpatient facilities, since that's, not community-based as much. And then emergency crisis response, like were we talking about that in 1963? What do you think?
Yeah, I think that it's a great question. I don't remember much about the Community Mental Health Centers Act at the time that it was passed. I was 10 years old at the time, but I have researched it, and I think it was a wonderful public policy step forward. And of the 5 what were viewed as core services that every community mental health center had to have. It looks to me like, and emergency crisis response was a part of it, as I recall. And so early on, there was a federal role in emergency services through the Community Mental Health Centers Act, and outpatient clinics were a part of it. And for inpatient facilities, we have to remember the timing, because the mid-50s was the time of large state institutions. But inpatient care was starting to be brought into the community, to community hospitals, medical centers, etc. So inpatient facilities were a part of that. So my inclination would be to say it was D, all 3 were included.
What do you think, Sarah?
Yeah, I mean, and I like that I just get to see what the audience said as well. I mean, if King Richard says D,
I know. Like, how could you not
right?
say,
Especially there's very sound reasoning there, Richard. So I like where you were going with that. I'm following along, so I'm going to say D.
All right. Great. Isn't it neat to have call a friend as a team, like right there, right? And this is just a great reminder of the legislation by JFK being signed there in 1963. Let's go check out the answer. Indeed, all 3 were included. Crisis care was a core pillar. Exactly. 10 years old, you knew the answer to that.
Interestingly, I think the other 2, if I remember correctly, were consultation and education and evaluation. That's my recollection. I'm not 100% sure, but that's the way I recall it. Again, I was only 10, so I might have missed something.
I don't think you did. So today, 988 mobile teams and crisis facilities are filling the gap. That It wasn't fully realized in 1963, but we have definitely taken it on these days. So thank you so much to both of you. Let's go to over under with both of you. Great. So Senator Tina Orwall from Washington and Representative Steve Eliason from Utah, they're going to be doing their feature piece in just a few minutes, but between them, they've driven more than a certain amount of landmark mental health and suicide prevention laws. Richard, how many do you guess?
Yeah, this is a great question.
Mhm.
I mean, they have both been amazing champions and very effective legislators. I often refer to Steve as the one indispensable person without whom 988 would not have happened. And Tina has just done amazing things about trying to transform the reality, transform behavioral health crisis system in the state of Washington. But I also know from the time I was a congressional fellow, it's not easy to pass legislation. So this is asking about the number of laws that were passed as opposed to the number that were introduced, which would typically be a larger number. So I'm going to say they probably each have, let's say, about a dozen to their credit. So combined, I'm going to say 24.
Wow. Awesome. Okay, Sarah, do you think there are more than that being over, or do you think there are less than that between them under?
I thought I could just be Richard's hype person, that I could just like agree with everything he said. So it sounds like I have to, put a stake in the ground before, higher or lower. Just kind of based on what I'm seeing in the chat and what you were explaining about how it's not just introduced, actual passed legislation, I'm going to say under, not because I don't think these people are incredibly accomplished, but just because of the difficulty in getting that done.
Okay, that's totally fair. Let's take a look. Between them, they've driven more than 30 landmark mental health and suicide prevention laws. And I really speak, as you both are noting, the effectiveness of their leadership is reflected in that number. It is really a lot to get 30 passed like that. So let's go to the next slide, and congratulations to you both. Great. So this is a quote, coming out of the accidental death and disability, the neglected disease of modern society, that was done in 1966. And so part of the quote is, for many of us, it helped to define our careers. And that it says, I hope you enjoy this testament to the power of vision. And that is where we are right now with 988. It absolutely is a parallel and builds on that even. So take a look at that quote in your spare time, but just so great that the vision keeps going. Great. I'm going to turn this over to Laura Evans. Laura, go ahead.
Thank you so much, Megan. You're such a great GM hostess. So glad that you are hosting today. And I am so fortunate to have the pleasure to moderate today's Battle of the Bills with Senator Tina Orwall of Washington and Representative Steve Eliason of Utah. So for this battle, we're taking inspiration from the US Open, and we are going to do things a little differently. We are going to have 3 sets of 90 seconds each. Each legislator will have to highlight different bills that they have introduced. At the end of each set, we will issue a point for best idea, best bill. And at the end of 3 sets, we will crown a winner. I will serve as the line judge to ensure that we stay on time. And I'm going to ask the audience to weigh in the comments to make sure that you all are providing your comments and help us crown an overall winner. We are going to keep 3 things in mind, though. So just stay with me while I go over these 3 things as we think about the bills that they're highlighting. And that is which bill is ready to roll, which bill it can be introduced as is right now and adopted by legislatures across the country, which ideas can transform the healthcare landscape the most, and which bill or idea will have the overall impact that is sustainable and scalable. So again, 3 sets of 90 seconds each, thinking through which bills that they are introducing and are talking about can have an impact across these 3 items. So with that, I'm going to turn it over to Representative Eliason to serve first. Representative Eliason, you have 90 seconds.
All right. Thanks so much, Laura. Before I begin on the first one here, I just want to briefly mention that here in Utah, we had a national tragedy this week and with a political murder. And earlier this summer, we witnessed some Minnesota lawmakers that were targeted and one was murdered. I really excited today to work with Senator Tina Orwall because I want this to be a really good example of how people from different backgrounds, different political parties can come together on the most important issue and battle for better mental health. So the first bill is back in 2017. It was a resolution, and me and Senator Thatcher tried for quite a while to get a 3-digit number in Utah, and we failed. And my father used to say on really difficult things, that's going to take an act of Congress. So we're like, well, we failed at the state level. Why don't we try at the federal level? And we worked with Senator Hatch and Congressman Chris Stewart, who were sponsor in the picture on the screen. And that picture was in D.C., me, Senator Thatcher, and that's Ajit Pai, the former chair of the FCC. And again, as an example of bipartisanship, there were, of course, 2 bills that got us 988. One passed unanimous minus 1 vote. There's always one person. And the other one, I think, passed unanimously. So this was the beginning of 988. And we'll never, as they say, you can count the seeds in an apple, but you can't count the number of apples in a seed. And we'll never know ultimately how good this effort did. But very excited about the effort that we made to get this on the forefront of the nation.
All right. Thank you, Representative Eliason, and thank you for setting that stage. I'm going to ask Senator Orwall to volley back.
Well, thank you. It's an honor to be here. And I just want to say, Representative Eliason, just my gratitude. You're an incredible leader, and I really appreciate how you set the stage. And this is a nonpartisan issue, and I'm very inspired by your work. And thank you. 988 has saved so many lives, and I just want to thank you. So in Washington, I want to talk about how we're supporting people that are doing this very difficult work. And we know that we have created laws for people in 911 and our first responders. And so as part of changing our crisis system, we need to make sure all the people that are responding on 988 or in our teams also have those kind of protections so that they can do their job. In addition, for the bills in front of you, 2088 and 1134, is we also have that teamwork between 988 and 911. And this protects everyone when calls are transferred back and forth. So again, I think we think it's critical that there's protections. Again, we want people to be working in good faith because we know this makes a difference when people respond and respond quickly. And again, 988 has provided us once in a lifetime opportunity to really redo our crisis system. And I think this is a key part of it. Thank you.
Thank you, Senator. I think these are really important pieces, particularly if we don't have liability. It makes it a little more difficult for people to know that they can respond. But I think at the end of this set, I don't know, I'm seeing things in the comments, make sure you guys drop in what you think. But because even though it did not pass the Utah legislature, I think I'm going to give it to Representative Eliason. That groundbreaking work led to the creation of 988 at the federal level. So this point, set 1 is going to Representative Eliason, but Senator, I will give you the opportunity to serve for set 2.
Well, thank you, Laura. So for set 2, we're going to talk about what I think was probably one of my biggest lifts, and everything takes a team. And so I want to say thank you, Washington team. Many of you are here, Senator Dingra, but it was really setting the stage for 988 in Washington State. And thanks to the SAMHSA template and our negotiation with telecom and all the voices of families and people with lived experience that we passed 1477. This started our telecom fee. this allowed us to triple our call centers, and we have 3 fantastic call centers. So we tripled their staffing. We also did next day appointments on the public and private side. We set up a steering committee, which is actually includes people with lived experience to help create our system, and the first 988 tribal line, the Native and Strong. And this happened because of tribal leaders and Volunteers of America and incredible state staff. And we're so proud. It's answered by Indigenous people and with lived experience. And now it has text and chat. So thank you, SAMHSA. And we're really proud of that model, and we know it's making a huge difference. So again, we needed that stable funding. We needed to build our 988, a place to call, and I'm really proud that we were able to move this legislation.
Thank you, Senator. Amazing bill. I'm going to turn it over to Rep. Eliason for that response in his volley.
Yeah, thanks, Laura. HB 323, almost all the bills that I've worked on in this space are very bipartisan. Most or many are unanimous. This one was actually the most difficult to pass from the vote count. And what it did, and I'm actually going to start out with a quote from Desmond Tutu. He said, "There comes a point where we need to stop just pulling people out of the river. We need to go upstream to find out why they're falling in." And we know that they're on average, according to NAMI, about an 11-year delay between symptom onset and diagnosis of a mental health condition. And we know that the vast majority of mental health illnesses begin during the adolescent years. So the earlier we can identify and diagnose and then begin treatment, the better the outcome. So this bill put in place a way to start doing mental health screenings in our schools with written parental consent, age appropriate evidence-based screeners. They have screened just in the past 2 years over 16,000 children. About 50% of those children screened positive for some issue. They've done a warm handoff in about half of those cases to either school counselors and in-school resources or to local mental health authorities. And so we're getting way upstream on this. Of course, we still need crisis services. The hope would be that eventually this early identification will lessen the need for crisis services down the road.
Thanks, Representative Eliason. Is it just me, or are these sets getting harder? I feel like that is a very, very tough one. But I'm going to have to award a point to Senator Orwall. I think that bill is just such a landmark. Even though you all used a template, you guys reset that template with the work that you did, the work for Native and Strong. And I know how much you and Senator Dhingra received pushback from the telecom community and still made it through. So point to Senator Orwall, but Representative Eliason, I will let you go first for set 3.
Okay, great. Thank you, Laura. We got a heated match going on here. HB 32 passed the first, I think, February of 2020, just as COVID was flaring up. And it was really a landmark bill. It established funding for 4 crisis receiving centers. Of course, season 5 of Crisis Jam, the first live and on location, was touring one of those facilities here in Salt Lake City. It expanded our mobile crisis outreach teams, including to rural areas. It provided funding to create a program called Safe UT Frontline, which is an app that follows on to our successful Safe UT program for school students. This one's for first responders and healthcare workers, fire, EMS, anonymous and confidential. Also create the Governor's Suicide Prevention Fund that people can donate to. This bill passed unanimously, both the House and the Senate, had over 10 million of ongoing funding, millions of one-time funding. And then we had to come back into session a few months later because we thought COVID was going to gut our budget. This was one of only 2 or 3 bills that didn't have the funding revoked because on a bipartisan basis, we realized this is absolutely critical and probably needed now more than ever in light of what was happening with COVID. So this really helped round out the 3 steps of someone to call, someone to respond, and a safe place to go, and also someone to follow up. Thank you.
Thank you, Representative. Senator Orwall, your response.
Thank you. Well, I'm going to talk about someone to respond. it's so important when someone calls 988 and needs help quickly, that we have teams that can respond rapidly. You know, a lot of our mobile teams who are amazing, we're taking 2 or 3 hours. So what we did is we created a bill that would create clinical teams, and ideally they include EMS and fire, that could respond in urban areas within 20 minutes. Rural areas, it's a little different. It takes longer to respond. So we wanted these clinical teams that could be incentivized to actually be able to respond within 20, 30 minutes. And so this legislation, 1134, sets that up. We also use the funding to do co-location. So in 3 of our sites, 988 is with 911. They're transferring hundreds of calls that are better served by 988. We're really proud of that. We also have the MRSS, which is a children's outreach team. Again, they go out, they can stay 48 hours, they can keep serving them for 2 months. For our youth and our families in crisis, we want to go out all the time. Again, we think community-based services is important, and we funded 988 vans this year. So again, we want our teams to be clinical whenever possible and have ways to transport people to the care they need.
Thanks, Senator. Again, another great bill. And I feel like those years are important, where we were in 2022 versus 2023. This one is a tough call. I'm going to award points to both. I see in the chat we're sort of split. So let's go ahead and go into a tiebreaker. So we got 2-2. Audience, I really need you all to chime in here. Think about those 3 things. And to serve us up, I'm going to pivot it back to you, Senator.
Thank you. So one of the things I want to talk about is our incredible workforce. We need to support them. We need to be recruiting them. And so you see several bills up here, actually. Representative Salahuddin helped on the first one, which is 1811. That was his bill, and we teamed up. We need all of our co-responders to be trained together in the regions they work, so that they know about 988 and all these resources, so they know how to work together. We also were the first state to require the medical profession and our mental health folks to actually get 6 hours of suicide assessment and treatment training. So that's required in our state. And also key people in schools, counselors, psychologists, nurses. We want them to have the tools they need to be able to assess and connect people. We also are helping to pay for people to get their masters, especially to diversify our workforce. So we're helping to pay, and we're helping training them in DBT. We're the land of DBT, Marsha Linehan. And we hear from clinicians that they want the skill set. Through cognitive behavioral therapy, so that they can work with people in crisis. So we're trying to pay for their training. We're trying to make sure they get the clinical supervision they need so they can go do this incredibly important work.
All right. Thank you, Senator. How about you, Representative Eliason?
Thanks, Laura. HB 300 was passed in 2023, and it created a pathway that individuals coming out of an emergency room, having a visit from an MCOT team, mobile crisis team, or out of an inpatient unit, could voluntarily put their name on the do not buy list, the Federal Firearms Registry, and for a period of time allows them not to possess a firearm. In Utah, 58% of our suicide deaths are via a firearm. Nationally, it's over 50%. And we know that putting time and distance between somebody in a suicidal crisis and lethal means, such as a firearm, is absolutely critical. This bill followed on a number of other firearm legislation bills that I sponsored that's given out hundreds of thousands of trigger locks, biometric safes, and an educational program called Is Your Safety On? This bill passed unanimously, and it had a whopping price tag of $400 one time. If we can pass this bill in Utah, anybody can pass it in any other state. We know that these types of efforts save lives, and we also wrote the bill such that it could be seamlessly done without paper in a clinical setting and imported into the electronic medical records, and is just a key component of suicide prevention.
Thanks, Rep. Eliason. Crazy, $400, and we can help reduce lethal means. I think that's a worthwhile spend. So I'm going to ask you all to very briefly, what would you take from the other person's bills what do you think you would brag the most about, and what idea would you grab from Utah or Washington? Rep. Eliason first.
Okay, great. Thank you. Yeah, so probably the bill that I'm most proud of was HB 32 that we talked about earlier. That also created the warm line. We've had over 100,000 calls to the warm line. I was just at one of our crisis centers this morning. So almost every minute of every day, that bill is in some way helping somebody in crisis. In terms of steel, there's some components of Senator Orwell's bill HB 1477, entitled Someone to Call, that I really like, relating to follow-up after the crisis, next day appointments, and a bed registry. So things that I'll be looking to copy here in Utah.
And how about for you, Senator Orwall?
Yes, well, I think the biggest brag would probably be 1477, which was our startup 988 bill and created the Native and Strong line. It was a big lift. We met once a week with Telecom for 3 months. We all know each other very well. And it really kind of set the stage for the work we needed to do. So that would be my biggest brag. And I just say, Rep. Eliason, you're just doing incredible work. And there's a number of things I heard. I love your work in schools. I think the big steal for us, where we're really behind in Washington, is for the crisis receiving centers. And I know Utah and Arizona does great work in this area. We're still trying to figure out how to fund the operating, and we're starting to get those up and running. But again, a place to go is so important. So we definitely want to come visit you in Utah and really try to build on that work.
Awesome. Well, thank you, Senator, and thank you, Representative. If I have to say anything as a person in policy, I think each one of these bills has different components, from $400 ready to roll. I think that's a very easy pass, to total systems change with 1477. So I'm going to say that everyone is a winner here, right? The winner is the American public. We get amazing champions like you both. But I want to make sure that I direct folks to other bills, other information that Senator Orwall and Representative Eliason have introduced. Please check these out. Take these to your legislators. And again, you can check out more resources across where they're listed here, also on talk.crisisnow.com. And you can check out the Vibrant website. They have a legislative map tracking all of the bills that have been introduced related to crisis services. So this has been fun. Thank you all for enjoying this volley, and I'll turn it back over to Megan for the rest of the jam.
Laura, thank you so much. And Senator Orwall and Representative Eliason, what incredible work. And it really shows where the rubber hits the road and how to really implement something on a wide scale. So thank you so much for all of your leadership. We're going to move to the roundtable. And I will explain this in just a moment. Great. We have Drew Adkins, who's the State Mental Commissioner for the state of Kansas. And we have Audrey Wheeler, who's the Director of Government Relations for Guide Consulting Services. So, Drew, if we could please talk with you first. And I know that sometimes your staff call you Commissioner Drew. Is that right?
I think so, among other things, I'm sure. But yes, I think so.
So I just wanted to get your impressions of what you saw through this, and what your thoughts are, and how it might also apply to Kansas.
Yeah, so I think, a major kudos to the two the representative and the senator there from Utah and Washington. I think, funny enough, I started out working on Capitol Hill in DC. I went and worked in state government or state legislature in Missouri for about 3 or 4 years, and then I've moved into the executive branch. And I worked in appropriations too, whenever I was working in Missouri in the state capitol there. And I saw one side of things, which is, hey, we need to get these policies involved, we need to get the funding attached and get this out the door so that the executive branch can do their job. And a lot of what drew me to this job was the mental and behavioral health work that Missouri was doing at that time. And so moving from that lens to the executive branch to see that, right? That is a huge piece of it. We can't do any of it without policies, instruction, appropriation, authority, right? But the second piece of that is really executing on that, right? Which is our main job in the executive branch. And so, you know, I think some of the things that stuck out to me from those bills were the rural mobile crisis response teams, right? The crisis receiving and stabilization centers, the focus on youth suicide prevention, right? I think there was some SMVF, some suicide or some service members, veterans family work in there, right? For our service members and their families and our military veterans, right? And so it's all very important. Mobile crisis, all of those things are super important. I think it's important to remember too that these are not overnight a flip of a switch type of programming that can actually be implemented. And that's coming from somebody that used to think that, right? We get the money out the door, and then 6 months later, it's really hard to see the fruit of that investment. These programs, crisis costs are increasing every day, it seems. It's a very expensive program. And so the entire crisis continuum, bringing this back to Kansas and the Kansas lens, we've invested with our legislature, with our governor's office, and I'm very thankful for this, about $22 million in operational costs, construction costs, capital costs for crisis intervention centers for involuntary patients, also crisis stabilization units for our voluntary patients, right? These are our main deterrents for individuals heading to a higher level of care in an emergency room or to our state psychiatric hospitals. That's just in our CICs and CSUs, as we call it. So I know the senator from Washington had mentioned that earlier. You know, we're still figuring that out too. It's a blended payment model between Medicaid dollars, between state general fund dollars, and then also from block grant dollars that we give to our CCBHCs and our community mental health centers. So we've also invested about $10 million in mobile crisis alone. This is on top of Medicaid dollars and other block grant dollars that we're giving to our providers to do that. We've got a $10 million 988 fund. That's specifically for our 5 call centers. 3 of those 5 call centers are CCBHCs, but that specifically goes to them being able to staff up and actually provide the service of answering our calls, right? We have probably about a 90% in-state answer rate. We've got state institution alternatives with our private psych hospitals. We have Medicaid rates for that. We have Y-Link programs, youth leaders in Kansas for our kiddos for suicide prevention, right? And so the main point of all this is that there's so many direct and indirect costs that I think all of those advancements are huge for Utah and for Washington and for every other state that's doing it. I think what has been successful for Kansas is that we have been able to work with our legislature and with our governor's office. And I really love the bipartisan spirit because in Kansas, we have a Democrat governor, but we also have Republican supermajority in the legislature. But we find a way to understand what is important. And it seems like behavioral health is very important to that group. And that makes my job a little bit easier day in day. So just kudos to those 2 members of their respective legislatures and their bodies there. That's a lot of work, and very thankful to hear more about that. And Kansas is always happy to be a help where we can.
Drew, amazing. So what great work is happening in Kansas, and you being at the helm of that leadership, along with all of the collaboration and being able to work on in a bipartisan way. That's extraordinary. Thank you so much for sharing and, the great work you're doing. So, and let's go to Audrey Wheeler from Guy Consulting Services. Audrey, one of the questions I have is, in addition to your perspective, what advice do you have for leaders to get this kind of legislation passed? How should they work together?
Thank you, Megan. It was wonderful to hear such a great and really informative exchange around this legislation. The fact that Senator Orwall and Representative Eliason have gotten so many bills introduced and let alone passed in this space is truly incredible. And I think speaks a lot to the commendable work that they've done as leaders to reach across the aisle and make those kinds of connections happen. I think what struck me the most in listening to the debate is how many of these legislative efforts have sought to be deeply impactful, but are also easily replicable in jurisdictions outside of Utah and Washington. So as you mentioned, as someone at kind of working on the federal level, I'd like to zoom out a bit and highlight how some of these successful state level efforts can inform national policy and how those kinds of connections can happen. So, for example, strengthening crisis call systems and embedding workforce training are relatively standard steps that other governing bodies can do without reinventing the wheel, just because we have precedent now thanks to the strides made at the state level. So some of these things like basic infrastructure, like funding and staffing, there's some things that have become less controversial over time, and they can be a really good starting foundation whenever people are looking to kind of make those partnerships, because this is something that's become a more bipartisan and more unifying issue. On the other hand, of course, some of the larger reforms that got highlighted, like standardizing care for youth or some of the more novel approaches to firearm safety, those are going to be heavier lifts still, and they can and they will take some more time to get that kind of support and movement, especially at the federal level. Sometimes we see some of those more innovative suicide prevention measures require a significant bipartisan commitment, require longer term investments. And I believe ultimately what you need there is just a little bit of that cultural change and cultural exchange on how the average policymaker and even the average person is thinking about behavioral health. I think at the US Congress level, there's definitely a role there to scale these successful models from the state level to ensure the rest of the nation can receive the same care. And we want to make sure the policies like those coming out of Utah and Washington are not just pilot projects unique to one area. They can really become the blueprint for federal action whenever we're looking for new ways to move forward and change the landscape of crisis care. So ultimately, I would just hope that everyone watching today kind of got a clear lesson on ways that those partnerships can happen whenever we're seeking to strengthen crisis response systems, and that we can still continue building towards some of those more ambitious reforms, even if we're still just working on making connections while we're transforming the entire continuum of care.
No, I love that. I love the idea of taking a state example that's worked really well and connecting that to the national level. That's fantastic. No, thank you so much, Audrey. Thank you to you both.
Thank you.
All right. Let's go to this briefing room, the SAMHSA update with Bethany Myers, who's with SAMHSA. Bethany.
Hello, thank you so much. Thank you all for having me here. I'm Bethany. I'm in CMHS within SAMHSA. And just give you a few updates. I first want to say thank you so much to everyone who participated last week in last couple of weeks, and not only our 988 Day, but our World Suicide Prevention Day events that we had. It was huge success. Thank you so much for doing that. And as a reminder, September is still Suicide Prevention Month, and we still have lots and lots of resources on our website for everyone to go and look at and download and use. So please feel free to go to our website and see them. We always want to share and get the information out there. Also, if some of you might have received them or seen them, but last week, SAMHSA updated and released the strategic priorities for this administration, and crisis is a huge portion of that. So crisis is definitely something that we here at SAMHSA are still going to be focusing on, and it's going to be a big priority for us. We want to expand crisis services as much as we can. I will put a link to, actually I'll drop it right now, a link to the priorities in the chat for everyone to see them. But just know that crisis is at the top of that list, and we will be expanding them and doing our good work over here with the help of you guys, because we need everyone's help for it. But that's the biggest updates I have for SAMHSA. So thank you so much.
Thank you, Bethany. And how fantastic the support for crisis services and that continued leadership. So thank you so much. We're now going to turn it over to Dr. Brian Hepburn, who's Executive Director with NASHBID, to provide the NASHBID update.
Excuse me. Thank you, Megan. I'll make this brief. Want to thank everybody for joining in today, and also to thank the people that have been involved over the last 5 years. As we start year 6, it's pretty impressive what has been accomplished. Want to thank David Covington, Karen Jones, and the RI team for their excellent production of the 988 Jam. I also want to thank SAMHSA for its support, and especially to Richard McKeon for his continuing expertise and contributions to the Jam. Thank you to Senator Orwall and Representative Eliason. Those champions from Washington State and Utah, I think, are good examples of how we should all be working together in order to improve the lives of people all across the United States, and specifically for people who have mental health and or substance use problems. Want to also talk about funding a little bit. As we are going into year 6, our funding has changed. We're now looking at private sponsors. We've been very fortunate so far that we've been able to get quite a few private sponsors to pick up the funding so that we can continue with 988 Jam. However, if you and your organizations would like to contribute and sponsor the Jam, please reach out to me. I'll put my email in the chat. It's brian.hepburn@nashbid.org, and I will put that in the chat. Thank you very much.
Wonderful. Thank you, Brian. And now we are going to move to Allie Robinson. And Allie was one of the storytellers in Moving America's Soul on Suicide. She's an author and also does these incredible races. Allie, I'll let you go into that. Please go ahead.
Awesome. Well, thank you so much. Yeah, I did the death race over the summer, which is more like psychological torture than it is an actual race. There's no start and finish, but it lasts about 72 hours long. The water's cold, the nights are long, there is no sleeping, there is no rest. You're reliable for carrying all of your food and water. And I'm really driven to do these hard things because I have lived experience. I was 15 years old when I tried to take my life. And as I talked about in the Moving America's Soul and Suicide documentary, I had neurological damage that I couldn't walk when I first got out of the hospital. So to be able to go from a healthy 15-year-old to not being able to walk to now being able to do these incredible races and to inspire women and young girls to see what they're capable of, it really kind of ignites that passion inside of me, because when I talk to survivors, when I talk to people with lived experience, they all have kind of the same narrative that after their suicide attempt, they were treated like very fragile little eggs. They were like taken by their families and locked away and removed from social settings and, really felt isolated from the world, rather than having this mentality of let's get them back into the world. Let's see what they want to do. Let's show them new things. Like, they are not fragile. They are pretty darn tough. And so I found running and I found racing, but what is that race for somebody else, right? Maybe that's cooking or painting or, skateboarding, whatever it is, it's helping people find what lights them up. And I know that, people with substance abuse, right? There are programs and communities that are all about getting people back into the community and helping them find purpose and passion. But I don't see that as much when it comes to people that have lived experience. And so I just kind of keep doing my crazy things. In November, I am running 200 miles across the state of Florida to just inspire people that have maybe suffered from mental health or a suicide attempt, to show them that they are pretty damn tough and they just need to find what their race is.
Allie, that's incredible. And what a wonderful way to move forward and inspire all of us, and all of us to be inspired to find our passions and what lights us up, and to believe in people and believe in ourselves. So thank you, Allie. Thank you so much for that.
Thank you.
All right, I am going to turn this over to Kristen Ellis to take us home and wrap us up.
Thanks so much, Megan. What an incredible episode today. Huge thank you to Senator Tina Orwall, Representative Steve Eliason, my state representative in Utah, for giving us a behind the scenes look at how behavioral health bills come to life. And to all of you in the chat for showing up, engaging, and keeping this community vibrant week after week. Senator Orwall, Representative Eliason, consider this your formal invitation to join us in Crisis Now 4 to do an expanded version of today's conversation live at the event. Yes, Crisis Now 4 is coming in July of 2026, if you could believe it. It's just right around the corner, it feels like, alongside the NASHBID annual meeting. And it's going to shape up to be our biggest gathering yet. A place where leaders, innovators, and change makers are going to come together to shape the future of crisis care. So mark your calendars. We'll have more details coming soon. And it'll be right next to the NASHBID annual meeting in Washington, D.C. We just definitely wanted to, again, shout out to SAMHSA and NASHBID for being our rockstar sponsors for season 5. They have kept the Jam stage lit every single week. We'll soon be announcing our first 2 new sponsors, as Brian kind of alluded to in the NASHBID briefing room. And it's going to be an exciting next chapter for the Jam. As Brian also mentioned, he put his email in the chat that we are still looking for more partners to keep this space strong and the Jam rocking. If you know an organization that wants to join this movement, sorry, I'm also managing the slides at the same time. Now is the perfect time to connect. So yeah, please reach out to Brian if you are interested in also sponsoring the Jam in any way. But this is what you're really looking forward to, is what's coming up next week. Please join us for a powerful fireside chat with Dr. Thomas Joyner. We're going to explore the themes of connection and belonging and how these universal human needs are central to preventing suicide and supporting healing in times of crisis. And we love fireside chat so much, we're going to have 2 in a row. 2 weeks, we're going to have an important conversation with Dr. Jack Roselle on safety and assessment and how these practices can protect individuals while building trust and delivering truly person-centered care. So season 6 is our most dynamic yet, with conversations that inspire, challenge, and connect us from all around the world and across the country. So thanks so much for watching. Tune in, log on, join the movement, and we will see you next week.